Okay, guys. So this will be our first lecture on the diagnostic modalities in surgery, and I'd like to just give you guys an overview before we start. So, diagnosis modalities in surgery is more of like us just talking about the various things that aid us as surgeons to be able to know the right surgery to do, all right, or the various things that help us to actually investigate a patient properly, all right. So, diagnosis modalities and structures in surgery. Discuss the types of diagnostic modalities in surgery. And I saw different ones. We have the CT scan, you have the X-rays, you have so many ones. You have the PET scan, all right, so many things. I don't worry, we'll be talking about that. So, to avoid delays in diagnosis and treatment, conventional plain radiography should be complemented with other diagnosis modalities. All right. Now, these other diagnosis modalities include CT scan, sonography, or some people call it ultrasonography. There's contrast studies and endoscopy. Okay. So, for fast diagnosis, okay, and fast allocation of treatment, you can better study the human body properly before you actually conclude, okay? And to hasten this up, we need other means, all right? And not only the x-ray, but all these other means can be used, okay, for us to be able to make a fast diagnosis or treatment, all right? So these are like two surgeons trying to read out an x-ray. This should be CT scan of the brain, okay, CT scan of the brain and all that. All right, so on the next pages I will be looking at the different types of uh, modalities, or different types of modalities in surgery. Okay, so examples of modalities, all right, diagnosis, example of diagnosis modalities, right? We have the x-ray, of course. We'll have a comprehensive video on the x-ray. We have the USG, that's ultra sonography. Then we have the Doppler, okay. We have the CT scan, that's a computed tomography scan. Then we have the MRI, that's the magnetic resonance imaging. Then we have the nucleotide imaging. Then we have the PET scan, that's the positron emission tomography scan. Then we have the endoscopy. All right. So these are the examples of diagnosis modalities. These are examples of things you can use to speed up your diagnosis in surgery. Okay. Maybe like somebody had a car injury and you see that the side of his head is like swollen up, all right? So how do you know if this is a fracture or this is just bleeding? You don't open the skin to know, okay? You can just perform a CT scan ASAP and then you know whether it is blood or it is just a swelling, okay? So examples of these diagnosis modalities are actually things that help us diagnose faster, things that help us reach better decisions, things that help us um, actually identify the right treatment types to give. Okay, so this is just an introductory class. You guys don't have to worry about anything. I have single videos coming on each of these. All right, so just stick to our YouTube channel and see you guys.